My name is Dr. Dwight Lindell. I spent a good part of my adult life in the cardiac operating room doing heart surgery. I didn't care really what caused heart disease. I just didn't care. If you had it and you were in trouble, I could fix it. But over the years, I began to be a little troubled. I noticed that most of my patients had normal cholesterol levels. So it didn't quite make sense. And I began to study and learn and do the best I could to try to find out what's going on. I made the observation in the operating room looking down at the coronary artery that there was redness and swelling around the plaque area. Well, these are two of the cardinal signs of inflammation. This study, published in 2009, demonstrates that of 136,000 patients admitted to hospital with coronary disease, heart attack, had normal cholesterol, 70% of them. So the theory that cholesterol causes heart disease and is maybe correct only 30% of the time doesn't make very much sense to me. Cholesterol was labeled as a surrogate marker for heart disease because it's approved by the FDA in the United States for treating cholesterol. Specifically, in the product insert, it's not approved for treating heart disease. I've never been a believer in cholesterol. I don't think it's the marker. Based on the literature, I'm more and more convinced every day that it is not the cause of heart disease. It is a marker for something. It's a marker for eating too much carbohydrate, because the carbohydrate gets turned into triglycerides, which then are carried by VLDL. Once they deliver those triglycerides, that becomes LDL. So if you want to raise your LDL, eat lots of carbohydrates. If you want to lower your LDL, eat lots of saturated fat and lower your carbohydrates. Simple as that. We have reduced our eating of saturated fats. We have not eliminated heart disease. Vegetable oils actually make us worse than eating saturated fat. Where are we going from here? What is the real cause of heart disease? That it's inflammation. And that inflammation follows injury. Then the real question, and the one I ask, was what is causing the inflammation? It's sugar. And injury causes inflammation, and inflammation is the mechanism of heart disease. So really that's the basic mechanism of heart disease. Not cholesterol, not salt, sugar. Sugar. The most powerful health tool is not a treadmill, it's not a weight machine, it's a glucometer. If you want to stay healthy, have dinner, check your blood sugar an hour later. If it's more than 130, 120, don't eat what you ate. You can do that with any meal. The path to ill health is paved on hyperglycemia. It's a condition caused by eating too many carbohydrates. So once again, if you want to be healthy, control that blood sugar, stop eating the standard American diet, get yourself on a reduced low carbohydrate diet with extra healthy saturated fat and a moderate amount of protein. That's the key to health. Low carbohydrate nutrition is the key to health.
Y recuerda, controla tus carbohidratos, prioriza la proteína, no le tengas miedo a las grasas saludables, no azúcar, no alcohol, no comidas procesadas, sin trampas. Me gustaría escuchar tu historia de éxitos. Compártelos en el enlace de abajo.